Contrast echocardiography has evolved quite a lot the last decade to a very powerful diagnostic tool. What is this symposium promoting, and what are the highlights?
Yeah, well, we are having this conference now for the 22nd time, and it really changed from the beginning. So the first one is in '96 to now. In the beginning, we had a lot of clinical presentations, and about 70% at that time was cardiologists and 30% technical background, and now it's basically the other way around. Contrast agents has established in terms of using for diagnosis, especially perfusion, especially for liver imaging. Well, it's in the guidelines that when you do a liver image with ultrasound, you must use contrast agents. So for tumor imaging is very important. Originally, it was developed contrast agents for perfusion of the myocardium, so myocardial perfusion. But that's still in a research stage. So, and why is that? Because the reproducibility is not good enough. So it varies from clinician to clinician and patient to patient. That's basically.
There are quite a lot of scientists that are interested in this conference. There are quite a lot of people attending right now, and we see that there is a very high interactive interest. Many questions, many answers, high dialogue.
Yeah, most of the time more questions than answers, because it's easier to ask questions than to answer them. No, but that's also one of the basis of this conference. So that's also why we want to keep it small. And because you want to learn from a conference and not only get the presentations and then applaud and then the presenter is gone. No, so the interaction is a very important issue, because then you get ideas and generate probably new directions as well.
We have seen also that invited speakers represent many countries from all around the world.
Yeah, so, well, USA is of course an important continent, but also South America, Japan, China. And well, China is of course a very important country for using contrast agents. Because, well, for example, for liver imaging, you can do MR or CT scans, and you see different things. But contrast agents is relatively cheap. So a study with ultrasound and contrast agents is quite cheap, and you can directly do it. So that's but we get a lot of presenters from all over the world. Yes. Yeah.
We also see that there are many posters. There is a poster competition, and many people have given their posters here.
Yeah. Well, we also try to motivate that. Tomorrow in the afternoon we have an oral competition about bubble cell interaction, and you can earn €1,000 with that. So that's quite some money. And also the poster prizes, we have prizes for that, and so that's the way, in my view, to attract young people, PhD students, and that's what we want, because we want to keep the field alive, and that the amount of people doing research in this field is increasing.
So there's still tomorrow. What are we going to expect in tomorrow's presentations?
Tomorrow morning we start at 7:30 with the moderated poster sessions, and these are already over here. And basically we have a presentation of each poster of 5 minutes and 5 minutes of questioning. And around, I'll say 30-40 people are standing then and looking at the poster and the presentation, and then they can ask questions. Later that day we have technical presentations of the bubble vibration, so the modeling and things like that. And at the end of the day, this competition on cell-bubble interaction.
Thank you very much for this wonderful conversation.
Okay, thank you.